Hello all, hope you all are doing good. Welcome to 91st webinar on MITRA. The topic for today's session is how to improve handwriting in children. Today's session is presented by Dr. Samraj Johnson. Dr. Samraj Johnson is occupational therapist, sensory integration therapist with 20 plus years of a very warm welcome to you and looking forward for your wonderful session, sir.
Yeah, hi Soljini and hi all the parents. I guess it's been quite a long time now, and hope, as Soljini said, everybody is doing good. And as for today's topic is concerned, I think it is all about handwriting skills and how to really, train your child. So this is basically, I'm just going to give you a gist of what actually you should be looking at. If you're really trying to work with your child in terms of developing or making them good in their handwriting skills. So what we really know is handwriting is no longer a subject, right? It is no longer a subject, and those days of penmanship workbooks are long gone. And nowadays it is like we say that here is the letter and here is the sound and here is the word, and we tell child now write it. It has gone up to that level, but it is important, very important to understand that maybe the statement which I made is for children who are good in their academic skills and who are going to school, but for children with concerns in terms of their development and in terms of their developmental ages and social ages, still the penmanship workbooks are in place. So in order to really get a child develop how to go forward or how to move in lines of their handwriting skills, there are certain prerequisites. So I hope all the parents have got a pen and paper, because whatever I'm going to tell you today, please pen it down and retrospect yourself and try to identify the problem areas with your child and be specific in training them with that particular problem area so that they develop these handwriting skills. So I'll just hold for 30 seconds. So in case if you don't have a paper, just try to procure pen and paper. So meanwhile, I know that it is a major concern for many of the parents, and all the parents do hope to see their children perform academically and perform and develop handwriting skills the way it should be at the peer level or age appropriate level. So it is important before you really start working with your child in terms of developing this, you need to really understand how to really progress with your child and how to really train them so that their levels of functioning in this area will be optimal. And so that, you don't get frustrated in training them, nor they get frustrated in learning it. So please make sure that whatever I'm trying to put across, it's precisely and primarily with all my experience and the way I teach or the way I go about teaching a child with handwriting skills. So this is not something which is written in the books, or this is not something which is an established model of training a child, but this is how I have been training. So I'm just trying to impart my knowledge into it, my knowledge to you, so that it might help you out in terms of understanding your child. So what do I look before I look into getting a child to learn or to train with the handwriting skills? The first thing which I look, I go by developmental learning hierarchy, and in that I first look for reflexes, primitive reflex integration, and there are precisely few primitive reflexes which play a vital role or which impede the growth of the child, in learning handwriting skills. So these reflexes are Morose, TLR, ATNR, and palmar grasp and vestibulo-ocular reflex. These five reflexes, if they are not really integrated, they play a vital role in terms of getting a child to learn handwriting skills. So just check yourself first. This is the first thing which you need to be looking at. So check yourself first with these five reflexes: Morose, ATNR, TLR, palmar grasp, and vestibulo-ocular reflex. And the next one which I will look into is the posture, whether the body is upright, whether the neck is upright, whether the child is able to cross midline. These are the three predominant factors which I will be looking at before I work. Body is upright, neck is upright, and whether the child is able to cross midline. Then comes the musculoskeletal structures. When I talk about musculoskeletal structures, it's all about to do with the muscle tone, muscle power, muscle endurance, and whether the child has got any deformity in the hand or any other deformities which are playing a role in which are limiting the child in terms of his progress. So when we talk about musculoskeletal, it is about muscle tone, muscle power, muscle endurance, and any deformities. And then comes, I look into sensory motor integration. And in sensory motor integration, it is all about auditory distractions, visual distractions, any tactile defensiveness, and any oromotor concerns. And why oromotor concerns? Because if child is hyposensitive, if child is orally hyposensitive, whatever you give into his hands, maybe a pen, pencil, crayon, they start chewing on it, and the level of attention or the level of concentration which they need to give towards the task in front of them will be distracted. So I look into that oromotor concerns and look for poor vestibular and proprioceptive processing, because they help and they aid in terms of muscle tone as well as their ability to maintain an upright posture. And usually when we talk about modulation in sensory motor integration, the sensory based modulation disorder. So when we talk about this modulation based disorder, the one which predominantly I look into is the modulation affecting the activity level, how this information is being modulated and how that is affecting the activity level. And the second one in modulation category which I look into is modulation related to or modulation affecting body position and movement. And the fourth one, we all of us know, is a major area of concern, that is sensory based motor disorder. In this predominantly, again, when we talk about sensory based motor disorder, we have discussed previously that it is about the postural disorder and dyspraxia, right? So many of the children who are going to school, they get stuck with this particular dyspraxia, especially the sensory based motor disorder, because their ability to motor sequence, looking at the board and having this coordinated movements on their tabletop to copy it from the board is where they get affected with. So usually the most the high percentage of complaints which I get to see are that my child is lagging behind doing the classwork or lagging behind doing the homework. So that is predominantly to do with dyspraxia. So these are the ones which I look into when it comes to sensory based sensory motor integration components. And then the most important thing, which many of the parents or many of the therapists usually tend to forget or not really take it into consideration, is the developmental hierarchy of our body. And that developmental hierarchy is, as all of us know, that when you talk about the developmental process of rolling or creeping or crawling, and these all are based upon four factors. One is stability. That means the stability means the core strength of the proximal joints, or the girdle, shoulder girdle or the pelvic girdle, the bigger joints of the body. So the stability needs to be established there. That means when I say stability, that means that it's a muscle power and the muscle girth and the muscle endurance at this particular level is the first one which develops in a child. So if your child is having weak shoulder girdle or shoulder strength, then working with hand really becomes very ineffective. So understand that stability is the first factor which develops in them, and then comes mobility, and then stability on mobility. Like for an example, if I have to say, maybe child is more comfortable, or not just child, for an example, it's between you and me also. I can write for a longer duration of time if my elbow is stabilized on the table than writing on the wall, right? That is predominantly to do with your shoulder. That is the stability which I'm talking about. So more the stability at the proximal joints, your hand becomes more effective in terms of functioning. So that is the developmental developmental sequence which you need to be really looking at. And when you say this developmental stability, developmental sequence, it is first the shoulder, then comes your elbow, and then comes your forearm, supination and pronation, this turning. If you really observe your child, many of them have seen that this forearm supination and pronation is something which is predominantly not developed in them, but you will be expecting them to, write with the hand. So that is forearm supination, and then comes your wrist. And when precisely when we are talking about wrist, many of our children, I find them having the wrist in this flexion position, like the wrist being in flexion position, because the strength of the extensors which is not in place, the wrist extensors which are not in place, where child is not really able to hold the arm like this to write. And if you really see the functional position of the hand, if it has to be effective, it should be in extension. The wrist should be in extension. Then only the ability to use the fingers will become more. The ability to use effectively, the ability to use your fingers will become more effectively if the wrist is in extension. In other words, if the wrist is in functional position. So just look into that, this criterion. And once you finish off talking about the wrist being in functional position, let's say that the child is having tactile defensiveness, where child has not really learned how to use his hand, or he has not explored using his hand and especially the thumb, you will not be able to find this thinner eminence, the eminence which when you move your hand, you will not be able to find it. And if you don't have this muscle being developed properly, or this muscle being developed properly in your child, that means the usage of the thumb is minimal. And as you know, thumb plays a vital role in terms of uh, handwriting skills, right? To be able to hold the pen or hold the pencil, it's the thumb which takes the first role. So it is important to look into these kind of developmental things. That means right from the shoulder to the fingers. This is how the development process goes. So if your child is not really good with shoulder stability, or if your child is not having enough muscle power or enough muscle endurance in the shoulder group of muscles, that means the way they are going to use their hand is going to be ineffective. So keep working in that process. Try to identify that when it comes to the developmental sequence of it. And when we talk about the fine motor skills, it is all to do with the grasp, the pinch, in-hand manipulation, the precision, and the stereognosis. These are the important 5 factors which we really look into. Grasp strength, pinch strength, in-hand manipulation, stereognosis, and the precision in how they use it. And when it is important, right? It is pretty much important to know that how you hold your pencil is important for many reasons. You know, the way you hold your pencil is quite important. First, it determines how much control and movement you have on the pencil. To put it in a simpler way for you to understand, if your hold is very loose, if your ability to hold a pencil, or the grip strength or the pin strength is very weak or very loose, that means there is a very poor control in how you are going to use, and there are going to be jagged strokes, and the lines are going to be too long, like, you know, beyond that, between the points, it's going to be too long. And if let's say this particular grip or the grasp is too tight, that will result in limited movement and heavy pressure and slow work production. That means they will not be able to complete the work on given time. So that's how important this grasp is. If it is loose, also there is a problem. If it is too tight, also there is a problem. And the way you hold it, if the grasp with fingers is wrapped around the pencil shaft, like, you know, many of the children hold pencil like that, or if their grasp is wrapped around the pencil, it will limit their visual field and making it difficult to see whether they are sticking between the line or not. So it is important. That's why it's said that, you know, holding your pencil is very important, and the way you hold your pencil will determine a lot of factors. And it is not necessary, please understand that it is not necessary that every time you hold a pencil in a different way, that means your handwriting is going to be inefficient. Some children will hold it awkwardly, but still they are very legible with their handwriting skills. Like what we usually say is, don't fix something which is not broken. In other words, like, if it is not broken, you don't fix it, right? So if it is efficient, you don't have to correct it. Only you intervene when it is affecting their writing skills. So if this particular kind of grasp or pinch is affecting them in their legibility or affecting them in writing skills, then only you have to intervene. So many at times you see, we Indians usually hold a pencil like this and write, but if you see Americans, they hold it like this. So it doesn't mean how you're holding, as long as it is efficient. It is about, if it is not efficient, then only you are going to intervene into it. As I said, like we don't fix something which is not broken. So just look into that particular pencil grasp. I mean, pencil grasps in terms when it comes to fine motor skills, and the cognitive factors. The cognitive factors which play a role in this handwriting skills is all about attention, concentration, decision making, judgment, the memory and visual perceptual skills, auditory perceptual skills. All these factors can be taken into cognitive level, and just look into that whether your child is in place with these cognitive factors to take it forward. Okay, so to make it very simple, I usually have got a questionnaire of my own. So probably I'll just let you know, maybe, yeah, just let me go through that questionnaire for you, so that if it is helpful for you, just try to mark on it and see whether your child is precisely having any concerns with that. So the first one which we look into is, does child hold pencil correctly? This questionnaire is predominantly to do handwriting skills, but the ones which I've spoken previously are the prerequisite skills to really look into handwriting. So before you look into handwriting skills, the ones which I've spoken, whether it is reflexes, whether it is motor patterns, whether it is sensory motor integration, or whether it is to do with their fine motor skills, whether it is to do with their cognitive skills, please check that first. Those are the prerequisites. So before, if child has not really attained those things, or if the child is not really good in those things, just don't shift into handwriting skills. First correct them and then come to handwriting skills. And this questionnaire which I'm going to talk about is predominantly to do with the handwriting skills. In that, the first thing which we look into is, does child hold pencil correctly or not, and whether child can perform other fine motor tasks, like coloring between the lines and tracing on a line, or cutting with scissors on a line. These are certain things which I look into before I really. This is one of the questions in that questionnaire. And can child recognize and name all the alphabets on a visual field, which means on a chart, on an alphabet chart, whether he is able to really appreciate and recognize and name those letters and name those alphabets correctly or not. And does child know how to form letters? Can child make letters so that it is recognizable to the reader? Which means, at this point of time, we really don't take into consideration the size or placement of the letters on the writing line, but we'll see whether child knows how to form the letters, on is it recognizable by the reader or not, whether it is legible or not, is what we see. And does child understand the purpose of writing between the line? Does he have the concept that he should stick between that line to write letters, and does he attempt to use it, or does he just go to this empty vacant spaces on the paper but not being on the line, between the lines? So we really look into the component, whether does he really understand that writing has to take place between two lines or the writing lines. So that is one of the component which we look into. And can child verbalize the placement of letters on writing line? That is which is that letter which needs to touch the top, which is the between the lines. I'm talking between the lines. Does he have that concept that this letter has to touch the top line or the middle line or the lower line? So that is another component which I look into. And can child read from a visual model without assistance? And then comes the other question, can child copy letters from a visual model? Does he have this ability to look into the board and copy it? And does child have a good understanding of sound and symbol relationship? And is child struggling with spelling? Is another component which we really look into. And can child organize their thoughts orally to form a sentence before attempting to print, before attempting to write? So these are the 11 or 12 questions which we ask ourselves before we actually intervene with a child with handwriting skills. But if you really look into these 11 or 12 questions, if your child is affected in any one of those areas, that means they have got something to do with the prerequisites which are not in place. So first, look into the prerequisites. Second, look into this questionnaire, which can lead you towards understanding which are those prerequisites which are missing out, and to develop a program or develop a plan on where you need to actually intervene. You will be able to do that with this questionnaire. So just understand that and start working with your child. Now, before really moving into handwriting skills, let us really understand the pre-writing skills, right? Because we know that pre-writing skills are the foundation skills a child needs before we would expect them to engage in handwriting, right? They are the foundation skills. So a large part of this includes learning to imitate and copy strokes, the two components, right? When we are talking about pre-writing skills, how they are imitating and how they are copying. And this precisely uh, uh, will take place only if the motor skills become automatic. Like, there is no thought process where child has to really think about how to move his arm to make that letter. If the motor pattern is automatic, it is giving the brain, it is giving that brain to focus on higher level of cognitive parts of writing. So it is important, please understand, this is very, very important. It is important as a parent for you to know that the motor patterns need to become automatic even before you start working on pre-writing skills for a child. So please work on that so that child's ability to write, or the brain's ability to really focus on writing, becomes more easy if the motor patterns become automatic in them. And usually these motor patterns, as usually, they follow a developmental sequence. And the best, I usually use a combination of two OT assessments. One is BERI, visual motor integration. Probably you can pen it down or ask your OTs to really look into it. I use the combination of these two assessments because I find that it is important to know where to start when you have to work with the child, and these two assessments will give you an idea about where to start with your child. So the first one is BERI, visual motor integration, and the second one is Peabody. So most of the parents who are in US might be aware of the Peabody, but if they have not done BERI, visual motor integration, just ask them to go ahead and get BERI, visual motor integration also, because typically, as we know that we expect a child to imitate first before copying, and we ask them to draw straight lines because they are easier than diagonal lines, right? So it is imitation before copying, straight lines before diagonal lines. So that is one of the thing which this combination of these two tests will give you. And between, as you know, that we need to really understand the development of a child in terms of their writing skills or the pre-writing skills, because sometimes we will be in a hurry without knowing where our child is, and we want, or we try to teach them. We try to teach them maybe before the age which they need to acquire it. So just a list of it, as all of us know, by 2 years of age, a child should start scribbling. And between the 2 to 3 years of age, they imitate, and they first imitate, and then they start copying the vertical, horizontal, and circular lines between 2 to 3. And 3 to 4 is where they imitate and copy a cross. copy across, and right and left diagonal lines. See this, that is between that 3 to 4 years of age, and between 4 to 5 years of age, we expect them to copy a square, copy a cross, and copy a triangle. So it is till 2 years scribbling, 2 to 3 years it's copying vertical, horizontal, and circular lines, and 3 to 4 years it is imitating and copying across and right and left diagonal lines, and after that it is all about square, copying a square, copying across, and cropping a triangle. So this is the first thing which, as a parent, which you need to know, the developmental sequence, and establishing a program on where to start, and where to start will be given for you with these developmental ages. So just understand where your child is in that, and start from that particular point. And the second most important thing when you are working on in terms of pre-writing skills is using visual cues, right? Visual cues, nothing but having a start line and an end line. And usually I go with green and red dots or green and red stickers to show them, because we know that those are the primary colors and that will help in child remain focused. So usually that is a visual cue I give, rather than drawing two lines and on a whiteboard with a black marker. So I use green and red dots to help child perceive it more, and to reduce the figure ground aspect of it too. Okay, so visual cues does play a very important role when you are teaching a child with pre-writing skills. And then comes you need to start embedding this particular kind of teaching to them into their daily routines. The best way to do this particular thing is, where all I'll just give you examples so that you can implement it more on your own lines. Like on the fridge, let's say I'm teaching my child mm, how to draw a vertical line, and if that has to happen, if that has to get included into the daily routine, then usually what I do is I'll fix this picture on the refrigerator, on the fridge, and whenever my child goes to open the refrigerator to take something out of it, first they need to draw that line and then open it. So these are certain kind of things which we usually do into. Or if you're getting your child to do some tabletop activity, just in terms of a sign-in kind of program. So before you get them to do that particular activity, and most of the time what we use is how we use it is the things which child likes to do the most. Like, he might want to play with a toy which is his favorite. So before getting him to play with the toy, we make sure that he signs in to play with the toy, and that signing in is copying this or imitating this vertical line or the horizontal line, basing on where they are, basing on at what age level they are. And so that is one of the things which you can do, that embedding this practice in daily routines. And the next one is the most important thing, is that whenever I see many of the therapists or parents or other people, they start working with the child on tabletop, especially for writing skills, which is very, very I would not suggest that. I would not suggest that. And the best way to work with your child, uh, if you're working on pre-writing skills, is on a vertical surfaces and vertical boards, because that will develop the proximal stability, that will develop the muscle power, that will develop the endurance of the shoulder girdle, and that will get the wrist also into functional position. So always use a vertical board in case if you are working with your child to develop the pre-writing skills. And you don't have to always practice this pre-writing skills on a pen and paper, right? You can use different modes, like encourage them to use to write these letters in sand, in shaving chrome, in shaving creams, and with play dohs, and encourage them to do it more, because that will aid in developing the muscles required in fine motor, as well as if they're having any kind of tactile defensiveness, that will aid them in overcoming it. So it is not necessary that always you need to practice this on a tabletop with pen and paper. You can use different modalities so that it will help in other areas of development too. Now let us, this is what it is all about, pre-writing skills. This is how you go about training your child with pre-writing skills. So understand that it is developmental based. Understand that it is age specific. Understand that if your child is not really able to do it, go back and look into the prerequisites which are coming in between way of his learning, correct them and get to this. So after you finish, after we talk about this pre-writing skills, it is all to do with the handwriting skills, right? The primary, the next level which comes is to handwriting skills. And there are three important things in this handwriting skills, which precisely many of the OTs and I also look into is number one, sequencing letters. First one is sequencing, second one is alignment of the letters, and third one is memory. Sequencing, alignment, and memory. These are the three components which come in way of their handwriting skills. And if you really don't understand these three components, it is very difficult to correct. It is pretty much difficult to correct or to train them in their handwriting skills. I don't know how many of you, what I'm going to speak now, whether I don't know whether you know how, this is the pattern or this is the way you train a child. So if anybody is having any doubt in that, probably you can ask me towards the end of the session. So first, let us talk about sequencing. Sequencing is nothing but forming a letter or a number using the correct order and stroke direction. Correct order and the stroke direction, and teach letters in group with emphasis on language or direction of the strokes. And when we talk about this, this is being categorized into capital groups and lower groups. Capital groups again is categorized into 6 different levels. Capital groups is categorized into 6 different letters, 6 different subcategories in capital groups. And the first one is, we call them as frog group letters. Frog group letters. And those frog group letters are alphabets, letters or alphabets. Frog group alphabets are F, E, D, P, B, R, N, M. F, E, D, P, B, R, N, and M. These are called as frog letters. And these letters begin with a big line down and a frog jump back to the top and then a small attachment to it. Like if you really talk about F, it is like a big line down to the bottom and they need to stop and they need to do a frog jump to the top and they need to add a small line there, so on the top and in the middle, so that it becomes F. So these letters are called frog jump letters, and the training for this frog jump letters is like that. Okay, so just make sure that they need to start on the top, come to the bottom, and they need to do a frog jump so that something gets attached to it. So these are frog jump letters, and the next level of it is called as magic C letters. Magic C letters, and these magic C letters are C, O, Q, and G. C, O, Q, G, and all these letters begin with magic C. Like, they, all the letters which I said, like if you take C, or if you take O, or if you take Q, or if you take G, they start with a C, right? So that's the reason they are called as magic C letters. And then comes silly S. That means the S. S is, that is nothing but a curve, two little curves. That means two little curves, one curve on the top, one C on the top and a reverse C on the down, which makes it as S. So that is one of the another category which we call it as silly S letters, and in that S is the only one. And then comes big line left letters, big line left letters, and this big line left letters are L, H, K. And then comes big line middle letters, which are T, I, J. T, I, J, big line middle letters. And then comes your diagonal line letters, that is A, W, X, Y, Z. A, W, X, Y, Z, and V. So this is the classification, and it is important for you as parents to understand that this classification of letters, and if you are combining these letters in this form, it becomes easy for child to learn. And if you're not, usually what we do as A, B, C, and we go like that, right? But if you cluster them into these groups, understanding of the direction of the letters or formation of the letters or formation of the alphabets or the numbers becomes pretty easy for the child to grasp and pretty easy for him to put it on paper. So always remember that this capital group cluster is that. The capital group cluster falls into these 6 categories. That is um, frog jump letters, magic letters, silly S, big line left, and big line middle, and diagonal lines. So these are the 6 categorizations and 6 clusters on how you can train your child. And usually I follow the sequence in that way. And if you really look into the sequence after the topic finishes, if you really retrospect into that, it is all about, again, the developmental age based, wherein we are coming with that, teaching a child with that vertical, horizontal, and circular lines, and then we are moving on to the next levels. Where it becomes complex down the line. So the sequence is laid down in that fashion. And then the second category in this particular area is lowercase group letters. And when you talk about lowercase group letters, again, we make them into 8 different clusters. Lowercase group letters into 8 different clusters, and the first one is shrinking letters. First one is shrinking letters, which are like COSVWXYZ. These we call it as shrinking letters. So probably you can, I'm not really going into telling you on how to work on it. If you understand that cluster, probably you can discuss with your therapist, and they should be able to help you out in how you train them with that particular clusters. Especially your occupational therapist or your special educator should be having an idea about how to take it forward. So shrinking letters, as I said, they are COSVWXYZ. And then comes again the magic C letters also in this. And these are COEAD, and Q. COEADG and Q. So these are called magic C letters. And again, if you really see, they have to start with the C in place first, and most of them turn into O later and tend to, have a little line added to it or have a tail added to it to form these letters. So then comes your diverse letters, diving, like, diving. Diverse letters, and in that diverse letters, we call it as a low dive, high dive, and deep sea dive. Low dive, high dive, and a deep sea dive. And the low dive letters are R, N, and M. Okay, and whenever you talk about diverse letters, what you need to remember is these are a little bit tricky letters because it will require a retracing. It will require a retracing. Like if you really look at R, you have to come and you have to retrace, right? So these diverse letters, whether it is low dive or high dive or deep sea dive letters, they are classified uh, basing on like a diver into the sea, a diver into the sea. So the low dive are R, N, and M, and high dive are H and B, and the deep sea dive is P, what we call P as in peacock. Okay, so the next category is line letters with a little line with a big line. 2 classifications again in that, line letters with a little line and with a big line, and letters with a little line are I, U, and J. I, U, J, and line letters with the big line are K, L, T, F. K, L, T, and F. Okay, and the last one in this subcategory is the hook letters. The way the hook is, so showing the position of the hook or the direction of the hook, the way the hook will be. So on that particular category, there are only 2 letters. That is, one is F and G. First one is F, and the second one is J. F and J. or this hook letters is what we call. If you really look at J, it is like a hook, right? It's like a hook. So these are the hook letters. So this is how we cluster the letters or the alphabets into different groups and teach a child basing on that. But you have to remember, if you are really following this kind of pattern or this kind of learning with your child, try to be consistent with how you model forming these letters and how you explain this formation to them, and always use same type of strokes, same name for the strokes, and same order. Same type of strokes, same name for the strokes, and the same order. So this is all about teaching sequencing or formation of a letter for a child. So this is how you cluster them into different groups and you train your child accordingly. And then when you talk about memory, when you really talk about memory, remember, in memory, it's nothing but remembering what a letter or a number looks like, right? And remembering the name of the letter and the number, and recognizing the letter and the number in a word or in a sentence, and remembering the correct stroke to form these letters or the numbers is what all memory is all about, right? It's about what is this letter, how is this letter, and how it is formed, and how whether the child is able to recognize that letter in a word or in a sentence is all to do with the memory of letters. We call it as memory of letters. And what the things which you precisely need to remember during this particular memory of letters before you actually train a child with this memory of letters is that you need to explain them the size concept first, the big and small. If you have not really worked on teaching a child with the concept in terms of size, then really don't go with working with them memory. And how you teach a child with a concept is, first you need to teach them with sorting, then with matching, then with identification, then with naming, and then with generalization. So that's how you teach them the size concept first: sorting, matching, identification, naming, and generalization. So first explain them the size concept, and then you need to be working upon directionality concept, left and right, up and down, which becomes very important for them to really memorize that particular letter. So explain the parts of writing line. So these are the three very important things which you need to really focus upon before you really try to train your child with letter memory. So one is size concept, second one is directionality, third one is the parts of writing line. The parts of writing line, that means the top line, the middle line, and the bottom line. So these are the components of memory. And then when you talk about the third one, which, as I said, alignment, right? And the components, alignment of letters, where they need to be placed. So the components of alignment are two. One is where each letter or the number begins, that means where to start. And the second one is the placement, putting them on the baseline. Putting all these letters on the baseline is the placement. So these are the two components, the start and the placement. They become an integral part of alignment. And then aligning letters correctly on a writing line is the other one which we teach them. And starting at the top line, which means, like, we need to teach them that that particular letter needs to touch the writing line on the top and on the middle and at the bottom. And that's what it says. Like, every time when we start at the top line, right? And then the placement comes, and making sure all the letters bump the bottom line. Like, when you start it at the top line, you should make sure that your kid is touching the bottom line too when he is writing within the lines. So then only the alignment will be in place. Like, usually that's what we do, right? When we take lines which are bigger, and then we'll start shrinking them into a narrower line, so that the child gets that concept that he should write within the line, touching the top and the bottom. So that is to do with the alignment, and making sure all small and middle lower cases are understood by the child without any confusion in that. And making sure that child understands that certain letters start at the middle line, and certain letters have what we call it as an upstairs and downstairs, fall lowercase letters, which have got the tail. The alignment, when you're talking about alignment, this is what you need to keep in mind, that the start of the letter and the placement of the letters to remain within that writing lines is all about alignment. And always remember, whenever you are working with a child in terms of teaching or training or coaching them with handwriting skills, always use lined papers most of the time uh, while teaching handwriting skills. So these are the important components which, as parents, you need to understand, and these are the clusters of letters which you need to understand. And as I said, the developmental sequence which needs to be followed, that also needs to be understood before understanding all this, or before implementing all this on your child. Ensure that all the prerequisites are first met, and then you start working on these areas. So this is what all handwriting is. So if you have any questions for me on this, I'm ready to take question and answers on this, maybe 4 or 5 questions. So Saujanya, I'm done with this, so any questions, I'm ready to go. Saujanya? Saujanya, are we there? So any of the parents, if they have questions, please unmute yourself, and you can ask me the questions.
So can you please repeat that big line middle letter? Which are those letters?
Big line middle letters are T, I, J.
Thank you, sir.
So do you have any questions on this, or am I good to close it?
Hello,
Yes.
sir. Actually, my son is 6 years, sir.
Okay.
He has skill of cutting a straight line. But when it comes for the marker, his way of holding is different. And when it comes to the chalk piece, a small piece of chalk piece or small piece of color pencil, he uses tripod, sir. But when I use sketch pen, pencil, or marker, the way he holds is differs, and the pressure also is changing, sir. How can I make it correct, sir?
So are you working on a tabletop with your child, or are you working on a vertical surface?
A vertical surface, sir.
So if you're working on a vertical surface, maybe it is more to precisely do with his proprioception of the smaller joints, where he is not really understanding how much of hold or the grip strength is required to hold that pencil. As I said, whether it is too loose or too tight can also affect the performance. So it is precisely to you need to understand about his pinch and grip strength in this particular matter, and then keep working on it. So there are certain dynamometers which will measure your child's pinch strength. So ask your occupational therapist for first to check the pinch strength, and then you look for pinch strength in terms of varied girth objects. See, when you say the marker might be bigger, but when you say the pencil might be lower in girth. So just look into those components first, and then look into it, ma'am.
So can you suggest any proprioceptive for smaller joints, sir?
Well, I can. We have already done that long back, so maybe you can put it in the group, and you will get the answers.
Okay, sir. Thank you.
Yeah.
While
Sir, this
Hello?
is Sucheta.
Yes, ma'am.
Actually, what my kid do, sir, when I hold his hand, he will write, sir. Other if once I leave his hand, he will just scribble, sir. Actually, so
This is one of the biggest concern of the many parents. Like when you hold their hand, then they'll be able to write, or you have to just place a finger on their wrist for them to write. So that is a clear-cut indication that the prerequisites which I have told you, that your child might be still having concerns with the integration of the primitive reflexes, or having that he has still not fallen into the developmental sequence of learning. So please look into the prerequisites and see which is the area which is affecting. And if you're not really able to understand how to really problem identify the prerequisites, just take a professional help. If you have taken down the notes, just ask your therapist to identify which is that area where your child is still having concerns with the prerequisites.
Okay, sir. Thank you.
You're welcome, ma'am.
Hello, sir.
So,
Hello.
Yes.
Sir, my daughter is 5 years old. Right now, she's able to write with the help of dots. The moment I put up dots, so she can, she can write with the help of it. But whenever I erase the dots, she is not able to, or she starts writing very lightly. So, I mean, how do I make her, confident, or perhaps I do not know what the actual problem is then.
No, thing is that by what you're saying, she really seems to be having concerns with her visual perceptual skills,
Okay, okay.
and you need to address that visual perceptual skills to take things forward.
Okay, okay. So, sir, if you can just give me some ideas as to how I can work with her
See, this is where the importance of making a child work within the lines plays a vital role.
Okay.
Teaching them to write things between thick lines, and then making those thicker lines and the width between the lines, and shrinking that width and reducing the brightness of that lines plays a vital role.
Okay. Okay.
so is there any specific size for the letters to start with?
Okay. Yeah. Yes, ma'am. Any more questions for me?
So is there any specific size for the letters to start with?
I actually didn't create any of the slides for that. Maybe I'll share it in the group.
Not the slides, sir. The size of the letters.
Size of the letter, font you're asking? The size of the letters. So
Yeah.
usually it depends upon the vision of the child, what to do. So ideally speaking, I start with 16 size.
Then slowly we have to reduce the size to normal
Yes.
book size. Yes.
Yes.
Okay. Okay.
So there is no set guideline for that, but I use 16 to start with. Thank you so much, each and every one of you. Hope this was helpful, and please take it forward. Any questions pertaining to this, just pitch in the group, and any questions if you have pertaining to your child, seek help of your therapist to take it forward. Thank you so much, and have a blessed day, and be safe. Thank you.
Thank you, sir.
Thank you, sir.
Thank you for your wonderful session.
Thank you. Thank you, sir.
Thank you, sir.
So very helpful to many parents, sir. Thank you so much.
Thank you.